So my name is Adam Younger. I'm co-founder and chief strategy officer of Payground. Payground is building a disruptive patient payments platform that makes it super easy for a patient to view all their healthcare responsibility in one dashboard and pay one or all their providers at one click. Additionally, what we have the ability to do is for the patient to load their spouse, their dependents, and many of us in this sandwich generation that we're now in, we can also load the financial responsibility on behalf of our parents. And so we are making it super easy for the patient to first understand their bill, taking out all the complications from the CPT codes, giving them a summary level detail of what their financial responsibility is. And then once they understand their healthcare bill, 40 times more likely they are likely to pay that bill. And so we give them multiple ways to pay that responsibility, whether it's paid in full with a ACH or credit card, whether that is loading up their digital wallet via Apple Pay, Google Pay, or even for some of those patients that need some financial assistance, we can fine-tune a custom payment plan, and we can even offer patient financing solutions for them as well. So the obvious downstream benefits for the patient is that they are able to better pay their bill, and then the benefit for the provider is that it increases their patient collections and decreases their overall days to collect. Paying a healthcare bill is often emotional. It's never a time of great joy unless you're having a baby. Usually there's some trauma associated to it, and you're meeting a patient with a statement in a time of great stress. So if we can help them again understand their bill and then give them multiple ways to fulfill that healthcare responsibility, then we're doing a good service to the patient, and we're going to increase the patient satisfaction as a result, which is very beneficial for the providers upstream that are very much in a competitive situation in the market, trying to get the patients to come into their system. It's very similar to in the consumer retail world where we see PayPal and Venmo being the dominant player, the household name. We envision Payground to become the household name for all healthcare payments. And if we get it right, if we can iron out the complexities associated with a patient paying their bill, then we think that that's going to be the magnet to then getting the providers to adopt Payground as a platform where we can then have their AR files submitted to us, their active AR submitted to us, and then we can then in turn request payments from their patients and then collect those payments and then post those back into the source of truth, whether that is their EHR, their practice management system. And then that end-to-end approach is really what is going to be the difference maker for us as it looks to healthcare payments. So we launched with our MVP December 2019. COVID hit, had a little bit of an impact. Very grateful to announce that we closed our seed round, a $4 million seed round in February 2021. That has allowed us to invest back into the platform, invest into the team, to get us to now go up market. We are very proudly serving more than 180 healthcare facilities today, ranging in size and scale from small ambulatory providers all the way up to very large state societies. And we are off to the races in a big way. We've seen that our average providers are able to increase their patient collections on average by 23%. They're able to decrease their overall days to collect by 6.7 days. And because of our flat rate fee structure and having a platform as a service mantra, we're able to typically do that at 32% less cost than their prior merchant processing platform was. Whew. A lot of lessons learned. The biggest tips I can provide for fellow co-founders out there is just make sure you get the right people in the bus with you. You can't take this burden of building a business on by yourself. So find a fellow co-founder, find a good team in place that can really support you and take some of the weight off of your shoulders, because it's heavy. Lifting up a business from scratch in a disruptive space like healthcare and fintech is super heavy and it's exhausting. So second point would be leave yourself enough margin. Otherwise, you're going to get burned out. And I'm not talking about margin from an EBITDA perspective. I'm talking about margin from projections. If your engineering team comes back to you and say it's going to take 2 sprints, assume that it's going to take 4. If you have modeled out financial projections and you're trying to 4x the growth of your business, maybe 2x it. Give yourself enough margin, because that will alleviate some stress that is put onto your shoulder and allow you to provide back value to your board and your shareholders, so that when you report on your quarterly outcomes, you actually have a good growth trajectory and you're not falling short on any of those expectations.